The misuse and addiction to opioids, such as heroin, morphine, and other prescription pain medicines, is a serious national problem. This affects public health as well as social and economic welfare. An estimated 1.9 million people in the United States suffered from substance use disorders related to prescription opioid pain medicines in 2013, and 517,000 suffered from a heroin use disorder. This issue has become a public health epidemic with devastating consequences, including the rising incidence of newborns who experience neonatal abstinence syndrome because their mothers use their substances during pregnancy, and also the increased spread of infectious diseases such as HIV and hepatitis C. At least 1,432 retail pharmacies showed questionable activity, including 468 that had tripled the average percentage of prescriptions for commonly abused opioids. Medicaid programs supported by taxpayers but administered by states also revealed excessive opioid use and probable fraud. In 2010, 359,368 Medicaid enrollees received an opioid prescription amounting to over 2 million prescriptions, and again suggesting that many prescriptions per patient. In 2009, 41.4% of Medicaid-enrolled women filled an opioid prescription compared with 29.1% of privately insured women, offering further proof that opioid makers are relying on public funds for their sales and profits. While Medicaid programs likely provide generic combinations of the active ingredient in oxycodone, hydrocodone to patients, which cost about $28 for a 120-day supply, taxpayers are still paying for this. Although opioid medications have a legitimate role in the treatment of acute pain and some chronic pain conditions, it is clear that they are often overprescribed or are prescribed without adequate safeguards and monitoring that their misuse can have devastating effects. This presents a dilemma for healthcare providers who seek to relieve suffering while preventing drug abuse and addiction. We are in the middle of an opioid and heroin epidemic, which is killing several, with the increasing numbers of Americans at an astonishing rate is only rising. In 2014, almost 30,000 people died from heroin and opioids, exceeding those who died in car crashes during the same year. Prescriptions from opioids have risen by 300% over the past 10 years and fed the heroin epidemic as the tolerance of opioid addicts surpasses their allotted prescription dosage. Most people know there is a prescription painkiller epidemic underway, but few realize how much the government is enabling it, how much taxpayers are subsidizing it, and how this is the root cause of the current epidemic, and something needs to be done about this.